Nursing 625, Collaboration and Teaching, July 2nd, 2025, Faculty of Health Disciplines Assignment 2, Lesson Plan. We acknowledge that today we are gathered on the unceded territory of many First Nations. We recognize and honor their enduring connection to this land, its waters, and all that call it home. We are committed to fostering respectful relationships and supporting the ongoing work towards reconciliation and healing. As we come together in this space, let us reflect on the rich cultural heritage and history of the Indigenous peoples who have cared for this land for generations. Our group is group number 3, and we are Fiona, Shay, Stephanie, and Olayemi. The outline for our presentation adjunct to the lesson plan are we will go through the learning objectives, an introduction, preceptoring, common challenges, and at the end you will see our page of references.
The learning objectives for today include exploring the role of a nurse preceptor in supporting new employees' integration into clinical practice, identifying common challenges in preceptoring, highlighting evidence-informed strategies that enhance learning, foster professional identity formation, and support safe, high-quality care in the workplace, and we will discuss a case scenario. Preceptorship is a structured process in which an experienced or competent professional, the preceptor, provide guidance and support and mentorship to another professional, the preceptee. It involves a one-on-one relationship for a defined duration, aimed at supporting an individual to successfully transition into a new. A preceptorship is an established process to support the preceptee's learning goals. It's arranged for a defined period of time, focuses on job-related knowledge and skills, requires the preceptor to act as a role model, and can progress into a mentorship relationship. Preceptees can have multiple levels of experience. They can be a professional with a number of years in the clinical area, but new to a specific unit, patient population, or teaching environment, or they may have limited clinical experience, with most of their background coming from a more structured and supported learning environment.
Let's take a closer look at why preceptorship is so important. First and foremost, preceptorship plays a key role in helping nurses transition into new clinical environments. Whether they're newly graduated or new to a particular unit, nurses often face challenges related to confidence, competence, and overall professional development. A supportive preceptorship structure helps address these challenges early on. Preceptorship also enhances a nurse's sense of belonging. When nurses feel connected and supported, it can lead to stronger recruitment and retention outcomes and ultimately better patient care. Preceptorship also strengthens relationships between experienced nurses and those who are new to the team. It encourages collaboration, knowledge sharing, and a team based approach to care. By easing the transition into practice, preceptorship helps reduce turnover and foster a more stable workforce. And finally, preceptorship contributes to safer care environments and improved team cohesion, both of which are essential for high quality patient outcomes. So while preceptorship may seem like a short term support, its impacts are long lasting for the nurse, the team, and the patients we serve. Let's shift our focus now to the specific roles and responsibilities of a preceptor. Preceptors wear many hats, and each role plays a vital part in shaping a supportive and effective learning experience. We have broken these roles down into 5 main areas. First, we have support and teaching. Preceptors serve as role models, educators, and mentors, helping preceptees adapt to the clinical environment while building the specialized knowledge and competence needed for the role. They review the preceptee's learning objectives early on and provide meaningful clinical exposure, gradually introducing more complex patient care scenarios. This structured approach supports both competence and independence. They also play a key role in clinical teaching as they demonstrate best practices and they are guiding clinical reasoning in real time. The second area we have identified is communication and feedback. Effective communication is essential. Preceptors promote open and honest dialogue, encouraging questions, clarifying expectations, and validating what the preceptee observes in practice. It is important to note that feedback is not just reserved for formal evaluations. Preceptors provide ongoing, constructive feedback, which helps the preceptee reflect, improve, and grow with confidence. Preceptors also maintain regular communication with the department lead and/or educator to share progress updates or raise concerns. The third area is collaborative learning. Preceptorship is a co-learning experience. While the preceptee is learning new skills, the preceptor is also continuously reflecting on their own practice, adapting their teaching style, and fostering mutual growth in a dynamic clinical setting. The fourth area is evaluation and emotional support. Preceptors must support the evaluation process by assessing their progress and offering thoughtful feedback, helping the preceptee to meet their learning goals. They also provide essential emotional support, helping preceptees manage stress, build resilience, and feel supported throughout their transition. The last area is team integration. Preceptors help integrate the preceptee into the broader team by fostering communication, collaboration, and a sense of belonging, an often overlooked but critical piece of a successful transition. Together, these roles ensure that the preceptee experience is not only educational but also empowering, laying the groundwork for safe, competent, and confident nursing practice. Next, we would like to highlight the key characteristics that make a preceptor truly effective. First and foremost, an effective preceptor is clinically competent in their role. Their strong clinical skills allow them to model best practices and instill confidence in their preceptee. Secondly, having significant experience in their clinical role and unit is important. This ensures the preceptor understands workflows and expectations, thus preparing the preceptee for real world practice. Preceptors must also have strong leadership and conflict management skills. This will allow them to be confident leaders who can guide, motivate, and step in to resolve issues when needed. They help set the tone for a respectful and supportive learning environment. Another key characteristic is enthusiasm. Passionate preceptors help inspire and energize learners during what can be seen as a stressful transition. Next, preceptors should have exceptional teaching, role modeling, and facilitation skills. This will allow them to break down complex information and explain the why behind decisions, and also model professional behavior, which is critical for effective learning. Effective preceptors also are positive and are patient. Preceptees are developing their skills and their confidence, which takes time. A patient and positive preceptor helps reduce anxiety and foster a safe space for questions and growth. An effective preceptor also has strong verbal and written communication skills. Clear professional communication helps set expectations, provide guidance, and ensures that both the preceptor and the preceptee stay aligned in their goals. Lastly, it is important that the preceptor has the ability to provide support and can provide constructive feedback. Effective preceptors know how to give feedback that is honest, helpful, and supportive. This helps preceptees learn from mistakes, build on strengths, and helps improve with confidence. Together, these characteristics set the foundation for a positive and effective preceptorship experience.
As a preceptee, stepping into clinical setting is both an exciting and important stage in your professional development. Your role begins with attending organizational orientation session. This is your opportunity to understand the culture, policies, and expectation of the environment you'll be entering into. From there, it's essential to develop clear, specific learning goals for your preceptor and to share those goals with your preceptor and department lead. Doing so creates a shared understanding and helps your team support you effectively. You'll then work collaboratively with your preceptor to create a plan to achieve those goals, making use of available resources and ongoing feedback. Engaging in hands on clinical practice is a central part of this journey. You're encouraged to participate actively, ask questions, and work alongside other healthcare professionals in a collaborative and interdisciplinary manner. Throughout this process, maintaining open, honest, and respectful communication with your preceptor, department lead, and the team member is vital. Communication builds trust, which is key to both learning and patient safety. It's important to seek guidance when you need it. This shows initiative and not weakness. Finally, taking ownership of your learning is possibly the most crucial part of the role. This means coming prepared, being reflective, accepting feedback, and progressively assuming more responsibility for patient care. The preceptorship is a chance to grow through active engagement, accountability, and a genuine commitment to learning. While the role of a preceptor is deeply rewarding, it also comes with several significant challenges. One of the most common reported difficulty is balancing patient care with teaching responsibilities. Preceptors are often required to juggle multiple roles in a single shift, such as acting as a bedside nurse, charge nurse, and a mentor, while caring for critically ill patients. This combination can be extremely stressful and overwhelming. Another challenge lies in managing the anxiety and inexperience of the preceptee. A lack of experience not only lowers a preceptor's self confidence but also increases anxiety, which can hinder learning and make mentorship more demanding. In addition, time constraint and the risk of burnout further complicates the preceptor's role. As workload increases, preceptor may find themselves compromising certain aspects of their responsibility, often prioritizing patient care while feeling guilty for not being fully present in the teaching role. These challenges highlight the need for organizational support, protected time for teaching, and strategies that address both preceptors' well-being and preceptee development. To support successful preceptorship experiences, it is essential to apply best practice grounded in adult learning principles. Adults learn best when content is relevant, goal oriented, and built on their existing experiences. One effective strategy is implementing a structured orientation plan which provides clarity, consistency, and a strong foundation for learning. This helps preceptors feel more confident as they navigate new clinical environments. Another key practice is setting clear expectation from the onset and maintaining regular check-ins. This moment of guided reflection and feedback allows course correction, boosts motivation, and fosters mutual accountability. Lastly, preceptors should focus on encouraging critical thinking rather than just simply giving the answers. Asking thought provoking questions helps preceptors analyze situation, reflect on their reasoning, and develop deeper clinical judgment. These strategies not only promote knowledge, retention, and skill development, but also empowers preceptors to take ownership of their learning, which is a core principle of adult education. For preceptorship to be effective and sustainable, institutional support is essential. Preceptors need more than just the willingness, they need the right tools, resources, and system in place. This includes access to mentorship, education, and peer support network that fosters collaboration and shared learning. One of the most pressing needs is protected preceptorship time, allowing preceptors to focus on teaching without compromising patient care. Additionally, formal training programs equip preceptors with strategies to support adult learning effectively, while ongoing education and strong support from senior staff help sustain their motivation and confidence. These supports directly impact preceptors' readiness, commitment, and performance, ultimately creating a more positive and productive learning environment for both preceptor and preceptee. When preceptors feel valued and prepared, everyone benefits, especially the patients we care for.
Case study. Emily is a newly graduated RN who just started her first role on a busy medical surgical unit. Her preceptor, Jordan, has been a nurse on the unit for 5 years. On Emily's third shift, Jordan notices she is hesitant to take on patients independently, even after demonstrating basic competency. Emily appears nervous, avoids eye contact, and rarely speaks during handover. She shares privately that she is feeling overwhelmed and unsure about her role. Discussion questions. Number 1. What immediate steps should Jordan take to support Emily? Number 2. What strategies could be used to build Emily's confidence? Number 3. How might the preceptor address emotional safety while ensuring patient care standards are maintained? And lastly, number 4. What role can the unit or organization play in supporting both Emily and Jordan? Conclusion. The role of a nurse preceptor is vital in shaping the future of nursing by ensuring student nurses feel supported and empowered during their transition into clinical practice. By utilizing evidence-informed strategies such as building rapport, providing regular feedback, and encouraging open communication, preceptors can significantly enhance the experience for student nurses. As we've seen in this session, effective preceptorship not only fosters professional and personal growth, but also contributes to the delivery of safe, high quality care.